Hi, Miss James. I'm Morgan. How are you today?
I'm all right.
I'm the student physical therapist assistant, and I'm going to be working with you today. Is that okay? Okay. Do you mind if I take a quick look at your band? Okay. Can you tell me your name?
Miss James.
Okay. Okay. Well, it looks like that we are going to do some exercises today. It looks like you recently had pneumonia. Still, okay. Okay. Well, it looks like you're just a little weak, and we need to build that strength and endurance up. Okay. Well, I'm going to do a couple tests, and we're going to do a couple exercises. Okay. And it looks like you met with the PT the other day, and they had a couple goals for you, and that's what we're going to work on, you and me. And short term, what we're going to work on is, you know, that your balance is a little off when you stand, and you're getting back to using that walker. And we want our long-term goal is for you to use that walker at home independently, because I know you probably want to go home. Is that right? Okay. Well, the first thing is I'm just going to really quickly just check your heart rate and your respiration rates. Okay? Is that okay? My hands might be cold. Awesome. Okay, your heart rate is great. I'm going to go ahead and just write down your numbers. Okay. Well, are you in any pain today? Okay.
Yeah, just my legs hurt and I just feel weak. I can't do anything.
Okay. And I don't know if you know, but I did a quick in your chart. Is there anything that I need to know? Any medication changes or anything? No.
Yeah, everything should be on there.
Okay. Okay. Well, I'm going to take a quick measurement of your hip, and you don't have to move. You can stay right there. If you can stretch out for me. You are fine just laying right there for me. Well, what I want to do is I'm going to bend this leg. I want you to get as far as you can for me. Okay? Perfect. Okay. Okay. Awesome. Now, what I want you to do is we are going to sit up. Okay? So can you sit up for me? Okay. And bring your legs over for me. Awesome. Have you used a gait belt before?
Yeah.
Okay. We probably won't need it, but just makes it a little bit safer. Okay. Is there anything around your stomach I need to know about? Okay.
It's going to be long today. I'm just tired.
You tired? We will make it short and sweet. I want you to also know that, a couple things to know that when you have that pneumonia, is laying down causes that fluid to build up on your lungs for that bacteria to grow, and you know, that is one of the reasons that you might have gotten sick. So sitting up is good for you, okay? And I know you're weak, and we're going to work on that, build some of that core strength so that you'll feel better. But just, you know, try not to lay down. I'd rather you be sitting in bed upwards than laying down flat, okay? Okay. Now, one of the things that I want to check is I just want to see how strong you are, okay? Now, are you able, you can put your hands right beside you, are you able to raise this leg for me a little bit? Okay, okay. Well, I just want you to raise a little bit, and I want to apply some pressure, and I want you to try to hold it for me. Perfect, perfect. Okay, you doing okay? Okay. That wasn't too bad, was it? Well, I'm going to lower you down. I'm going to get your walker. I know that you've used this before, and I know you know what to do, but I just want to go over a few things just in case you forgot. Is I do not want you to use this to pull yourself up, okay? Once you're standing, place your hands on it, and you'll be good to go. And for the first time, I'm going to help you. I know you've done it before, but just since you've been sick and feeling weak, is I just want to make sure that you're safe, okay? So can you scoot to the edge edge of the bed for me. Remember, scoot up, use your hands. Awesome, awesome. Okay. And once you're standing, we're just going to hang out for a minute because we're going to do one of our exercises. And I need you to be standing for this, okay? Okay? So when you're ready, on 3, I don't want you to push. Pull on this, okay? 1, 2, 3, stand. Awesome. Now you can put awesome, awesome, awesome. Okay. Feeling good? Feeling okay?
Yeah.
Okay. Now one of the exercises that I want to do with you is a weight shift, okay? So I want you to do is just right now is I want you to put some weight on this side. Just lean. Awesome. Now go to this side. Okay? Now see if you can let go of the walker. And I'm here, so don't worry. I want you to put some weight on this side. Leg. Awesome. Doing okay? This side. Awesome. Okay. We're kind of dancing. Okay? Okay? Awesome. Okay? Put your hands back on the walker. Scoot back and let's sit down. That was awesome. Glad you did 2 sets of 10. That's a lot. Okay. The next is while you're sitting is I want you to see, and I'm here, okay, is we want to do a stretch, okay? We want to stretch those muscles. So what I want you to do is I want you to put your feet out a little bit, okay? I just want you to try to stretch. Try to like you're trying to touch your toes and just feel that stretch in the back of your leg. And if you need to make your legs a little bit straighter, you feel it?
Oh,
Yeah?
yeah.
Awesome. Okay. Okay. One more exercise. Okay. And this one, we're going to use the spare band for. What I want you to do is we're going to use our ankle, okay? And I'm going to hold your foot, and I want you to keep your ankle, and I want you to pull up for me. Do you feel that? Are you able to do that? Okay?
It's tough, but
Okay.
yeah.
Okay. Good job. Okay. Now one more thing that I want us to do, one of our goals, is we to walk with the walker. Okay? So what I want you to do is I want you to scoot to the edge of the bed, lean forward, and stand up for me. Okay? I want you to stand up. Make sure you don't grab onto that walker till you're standing. Awesome. Okay. I want you to move the walker a little bit, and then I want you to move your right foot, then your left foot. Move the walker. Awesome. See, you're a pro. Okay?
I practiced a little bit.
Okay. Well, let's come back to the bed. Okay, let's turn around. Awesome. I want you to remember to keep breathing too. I don't want you to hold your breath. You want to build those lungs up.
Yeah, just that little bit got me kind of
I know.
short of
You
breath.
build those lungs up. In through your nose, out through your mouth. Okay. Now, I want you to do, we're going to do a couple exercises that I'm going to teach you that you can do when I'm not here. Okay? So if you want to go ahead and, I'm going to move the walker, is one of these we're going to do is called the seated march, okay? And I'm going to show you first how to do it. If I want you to just go ahead and raise one leg, and keep your hands, and raise the other one. Okay? Does it feel okay? Okay. And I might leave some ankle weights with you that you know, if your sister comes to visit you, that she can tie around if she wants to help you. Just lift. Okay? Awesome. The next exercise that I want to do is let me just, you stay right there, is we are going to have you, I'm going to have you laying down. Do you want to lay down in the bed for me? Yeah. Perfect. Perfect. I like that your knees are bent. I'm going to put this between your legs, okay? What I want you to do is I want you to squeeze. and I want you to hold. Relax. I want you to squeeze for 5, and see if you can hold 5 seconds. I want you to relax. Do it again for me. Perfect. Okay. Now the next one, and this is going to be really easy because you can leave your legs like this, is I want you to do, we call it a heel slide. Okay. And your sheets are probably slick, so you can do it. So what I want you to do is, and I want you to make sure you keep your stomach tight, okay? Is I want you to bring this up. I want you to slide your foot out. Bring your foot in. You doing okay? Perfect. Okay. Okay? Now, one more exercise. We call this a quad set, okay? So what I want you to do, and I want you to do these with both legs, okay? Just like every exercise that we've done. Is I want you to see, we're trying to tighten this muscle here. So what I want you to do is kind of try to put your knee into the bed, and I want you to tighten it. And I want you to see if you can hold it for a few seconds. And then relax. And your foot should go up. Your toe. So I want you to tighten for me. Good job. Okay. 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 Well, it's going to take some time. We've got to build that strength and that endurance. Okay. And I want you to do these every day. If you do them every day, even if you could do them twice a day, it would really, really help. It would help with that balance, that strength, your lungs, and that way we can get to that goal of you being able to walk with your walker and be able to go home. A few things that also, just to remember, is when you are using your walker and you're out of the bed, is to make sure that you either have those socks with the skids on it. I don't want you to be barefoot at all. So make sure you have some grippers on your feet. Okay? Also, remember with the walker, I do not want you to use it. I do not want you to pull on it when you're getting up. I know you're tired and it's been a long day. Okay? And I also want you to remember to drink plenty of water. These are going to be tough exercises, and we want to make sure that you stay hydrated. Okay? And remember, try not to lay down. If you can't sit up, for me. Okay? Is there any questions you have? Okay. Okay. Well, it was a pleasure working with you. Okay? And if you need anything, just let me know, and I'll probably see you tomorrow. Okay? All right. You have done really, really well today, and I printed off a few exercises for you to keep with pictures, and it has all the instructions. I'm just going to go ahead, okay, and I want to take your heart rate again, okay? Okay.
I do feel kind of tired. Like, am I ever going to be able to walk?
Perfect. You're doing really good. You will be able to walk. We just, having pneumonia has been a lot on your body, okay? And you just need to take your time, and you need to rest, but you need to see if you can do these exercises as much as possible, okay? I have a sheet right here. And why don't you go ahead, let's sit up, okay? Okay. Here are the exercises, again, and we have some pictures, okay? Do you have any questions? You remember that quad set?
And I did that one on the table. The legs were out. Okay. Do you want me to practice walking at all? Just when you guys
just
are here.
when someone's with you.
So I still need to ask when there's to come in.
Yes. We don't want you to get up without someone.
I feel like I can get to the bathroom, but
I know. We don't want you to fall. Okay? You've been sick, you got some things going on, so you just want to make sure that you're strong enough, and Now, if you don't mind, just let's practice something, and this will get your lungs going, and this, I noticed that, you have a little anxiety, a little stress, is a deep breathing. So what I want you to do is I want you to take a deep breath through your nose and out through your mouth. Do it for me. Do it again. One more time. Now try to see if you can use your stomach to breathe. If you want to use your hand, you want to try to hit your hand with your belly when you breathe. This will really help your lungs. This will help build up your endurance.
I feel like I'm breathing hard
Okay.
all the time. So it's harder. I don't know. I wasn't doing anything before,
Right.
so.
Okay. And it is going to be hard for a while. But that way it's really important to do these exercises every day.
Okay.
And eat properly and drink all the water you need. Okay? Okay? And just make sure, and I'll definitely let the nurses know that we need to make sure that you have some extra of those socks with little grippers on, so for when you're walking and everything. Okay? So do you have any more questions? Okay.
Thank you.
Okay.
I think I can do these things right now.
Okay, perfect. Okay, thank you very much.
Thank you.